on diabetes. So today we have Dr. Amit Goel who is joining us today. And the topic today we're going to discuss about how do we manage diabetes during festivals. We just Diwali just went, and we have a lot of other festivals which are coming by, including Christmas, and then there are a lot of festivals which are lined up. There's no end to it. So this is we thought we will take a moment to discuss about diabetes, and what precautions should patients with diabetes take during festivals. And I would like to thank Pulse Pharmaceuticals for sponsoring this particular talk and having Dr. Amit Goel again back on this particular show. And so thanks a lot, Mr. Amit Goel, for joining us on this particular show.
Thank you, Ravi. It's always delighting to be with WurkTV and Ravi as our co-anchor. So, thank you.
Thank you, sir. It's an honor having you. So, diabetes and festivals. Yeah, I mean, Diwali abhi gayi hai, and my stomach pain has just stopped after eating so many delicacies which family cannot, stop treating us with. So, I'm fine, but how do patients with diabetes, what are the precautions they should take care during festivals?
Yes. So as we all know, India is a land of festivals. So every month you have a festival, be it anything happens. So festival is an occasion where you need to, and sweets, especially with Diwali, sweets are one of its part and one of the things which are distributed across anywhere in India and worldwide.
True.
So what happens with diabetes, as we know, is it's a disorder. It's a metabolic disorder of where you definitely have glucose overproduction in your body. So we advise that glucose content should be decreased, because what's happening is the glucose overproduction, what is happening in the body, we do not have adequate insulin which is being produced, and also to cut down the overproduction. So that's how we would not want someone to load glucose from outside. So that's the whole thing happening. So any sweet which is made is definitely rich in carbohydrate, is definitely rich in fat. So fat would also in turn be converted into carbohydrate when it goes biochemically. So when you look at the conversions of all these materials in the body in biochemistry, it says that the fat content also converts into carbohydrates and so on and so forth. So it fires like a fuel to the patient. So what happens is, how do you avoid sweets? Now you can use certain ingredients which are low caloric value or low GI sweets, or low GI sweeteners such as libulose. Now I was going through data when I was talking preparing for the talk, or in our things. So there are a few Indian companies which are also making libulose based medicines.
Okay.
Libulose, yeah. So libulose is supposed to be very low GI. Its GI index is about 18. That's what I was told. So there are a few sweets which are available. So all other substitutes can also be used for making sweets. Not only sugar, but other substitutes can also be used for making sugars, for sweets actually.
Okay. That's interesting. I completely agree with the point which you said. India is full of festivals. Every month or every 2 months we have a festival that is coming in for every religion, and as Indians we would like to celebrate. Since we have friends with every religion around us, we definitely receive sweets, and we celebrate it too. So and it is very tough to do. And glad if we have some of these ingredients which can make the sweetening. I mean, we don't have to get deprived of sweets, but still, have it in control.
What happens is, now if you look at the COVID pandemic, has actually opened our eyes towards health. So, health was last in the calendar of Indian calendar, which used to come. Maybe governments, non-governments, everyone thought it was the last priority. So once lockdown came in, people started to realize that if the health is not good, you wouldn't have anything in your hand. So that's when the prioritizations came up. So if you look at data now, the health insurances have gone 30 times higher than what it was to previous years. So everyone's now running to get an health insurance because they're realizing the importance of health. So that's what. So what happens is, diabetes has been chronically there in the Indian scenario. So it is, I would say it is much more, 10 times, much more affecting every individual, every family than COVID. So people have to realize that diabetes was still there, is going to be there, and it's a chronic disorder.
Okay. What are the warnings and symptoms, for somebody having high blood, while
Yeah,
during these festivals and all that.
so it changes with again age. So now suppose I have a child who's coming to me. How do you identify? A child suddenly starts developing, excessive urination, starts getting drowsy, starts losing weight, or also has some severe burning sensations in the feet or something like that. Maybe start getting vomiting, getting drowsy. That's called as diabetic ketoacidosis. It's a medical emergency which is the initial presentation with type 1 diabetes. And in
Right.
type 2 individuals, the classical examples or classical textbook symptoms are excessive eating,
Hmm.
excessive thirstiness, and then you have excessive urination or getting up to bed at night. Frequency of urination increases. Certain infections like boils or certain things which are not getting treated with your normal antibiotics, which has been, or you have any wound which is not healing properly, or in also certain conditions which have been unnoticed for a long time, you can have weight loss. Why this weight loss occurs in diabetes is because, see, again, as I said, sugar is calorie. So once it's thrown out of the urine, you have calorie loss which is happening from the body, so you're getting leaner. So I get a lot of patients who say, I was like good, hefty build, and then suddenly started losing weight. So this definitely could be a opening or warning sign of diabetes.
Okay. I have a sweet tooth. I cannot resist sweets. Which are just stacked aside. So, will this, lead to diabetes because I'm having frequent sweets and I have a sweet tooth.
So it again depends on your family history. So suppose you have your both parents who are diabetics, who are type 2 diabetics,
Hmm.
and you're obviously at a risk of developing diabetes per se from genetics, and also you're overweight or obese. You're also contributing to risk factors. So you have a few risk factors, plus you are also not maintaining the metabolic profile of your own body. You're obviously at higher risk to develop diabetes. Or say you're a chronic smoker, you have stress. Now stress and diabetes is again a very new topic and a very new discussion which comes on. So
Right.
there are studies which say that stress induces diabetes, stress aggravates diabetes. So yes, definitely sweet tooth have to be avoided, or have to be restricted. So I would not say avoid, I would say restrict your consumption of sweets or consumption of your calories. Start doing an output more than input what you're taking.
Okay. Should I stay away from alcohol?
Yeah. So see, as recommendations by the American Diabetic Association or the worldwide associations, they recommend that patients with diabetes can have alcohol, can
Mhm.
have about 30 ml twice weekly is what is recommended. So, but what happens with can have, if I tell, his doctor has told can have that 30 will become 90, 90 will become 180, and so on and so forth. So 180 goes on to become a half or whatever. So please do restrict your quantity of alcohol. Avoid it as far as possible.
Mhm.
If you want to have it, please have it in a limited quantities. Not like you are a diabetic, you're going on loading yourself and then you're falling here, there, or you suddenly start having it, binge having it, and then you would want to stop it one day. One day you get a new girlfriend or a new friend and you just stop it, and then you have that tremors and you have withdrawal symptoms. So I would suggest have it in quantified medical quantities or medical quantified quantities rather than having just binge alcohol intake.
Okay. The next question, Dr. Amit, can diabetes also cause muscle pains? Will I
Yes.
have body pains and muscle
Yes.
pains?
So body pains can occur in diabetes. Again, there are certain studies which say that calcium deficiency can occur. So diabetes of secondary forms can present with these muscle pains. So now secondary form of diabetes is like something like a growth hormone excess, or you have a steroid intake. You have been taking a lot of steroids. You have developed hyperglycemia. It's not actually diabetes, but the sugar levels are high. You
Okay.
can have difficulty in sitting down, getting up, or normal diabetes also can present with a musculoskeletal disorder. Musculoskeletal in the sense the muscles and the skeleton involves. So there is definitely a risk of developing ill-defined pains and aches, or you have joint pains. The smaller joints of your hands are involved much more in diabetes. Or the other kind of joint pains you can have in diabetes is a frozen shoulder. So the most commonest is the frozen shoulder. Arthritis can be there, or you can have lower limb. pains which occur due to two other causes. Then one is a neuropathy, that's your nerves are being affected,
Mhm.
or second cause is you also have some deficiency of you have some vascular problems where your blood flow to the feet is not happening, or to the muscles in the lower limbs is not happening. That's when you can also get these kind of problems.
Okay. So, people who have diabetes, should they give up on going to gymming, and especially people who want to really build muscles and show their biceps, etc. So, does this work, or they
uh,
just have to give up?
See, diabetes is going to be better with exercise.
Okay.
So it should work out. So at the end, if you are losing 8% of weight, so now see, I have someone who has a pre-diabetes. Is a
Mm.
first step to developing diabetes. I would say them to lose 8% of their current body weight so that they do not get diabetes. So diabetics should exercise. Exercise is good in diabetes and it will keep healthy. So diabetes is just a metabolic disorder where it's again a consortium or a constellation of a lot of symptoms. So definitely.
Okay. So, will my gut bacteria or microbacterias, which are there, which is responsible for my digestion, are they also responsible for, establishing diabetes?
Huh. So now there are this is again a hot topic which is being discussed since a little while. They say that gut microbiota does play an important role in prevention of diabetes one, and also they've found that diabetics have gut microbiota decrease. So there is a decrease in gut microbiota. Hence nowadays there is a newer concept of improving gut microbiota, the human microbiome. So they're calling this concept as a human microbiome, where you can improve your gut microbiota and keep your diabetes under control. So there are so many review articles, so many exam questions which are coming on gut microbiota and diabetes. There is a huge link now. Now they've been the research has been going on, and definitely it says there's a huge link between the gut microbiota and diabetes. So how do you improve gut microbiota? Is again the conventional curd which we used to take, which we
Hmm.
every time take it with every meal, or there are certain probiotics in the market which you can take to enhance your gut microbiota. Because certain of the drugs which we use in diabetes can also decrease the gut microbiome. Also, that's why we ask our patients to get themselves replenished with all this.
Okay. Dr. Amit, for a layman, a person who doesn't understand diabetes much, what is the difference between type 1 diabetes and type 2 diabetes?
So there is a conventional saying type 1 diabetes occurs in children
Hmm.
or middle up to the age of 2022 also, sometimes later presentations, but it occurs in the children. It occurs in patients who are lean. It occurs in families where there is a no family history of diabetes.
Okay.
The insulin resistance markers such as blackening of the skin and all is much more lesser in patients with type 1 diabetes. It is insulin dependent. So the patient if diagnosed with type 1 diabetes has to go on for insulin for lifelong. So
Okay.
this is one part. Type 2 diabetes is a commoner part found in Indians or worldwide. It is more with the obese patients, comes in the later age, 30 onwards. But due to the secular trends being changed now, we see also, I have seen the latest is about say 18-year-old type 2 diabetics.
Okay.
They are obese. They have a strong family history of diabetes. They also have blackening or acanthosis. The markers of insulin resistance are well present with them. They might also have certain other features like hypertension, hypertriglyceridemia, which contribute to metabolic syndrome.
Okay. Uh,
They can they can they can be given oral hypoglycemic tablets with diet, and also insulin may be later part in the course of the treatment.
Okay. What should be the fasting, with respect to, for somebody who has got normal blood sugar?
Yeah, so we would say 80 to 130 in a
Mhm.
diabetic. For diagnosing diabetes, it is more than 126. Equivalent or more than 126 is diabetes. But if you're a diabetic, how would you want to target your blood glucose is 80 to 130.
Okay. Diabetes people have a lot of issues. I've seen a couple of diabetic people in the family, and while traveling, it's a big challenge. One carrying the insulin all the time, which has to be always kept in cool condition. But apart from that, what are the common foods? I mean, good travel foods they should take.
So yes, so I would say do not avoid your food when you're traveling. You can have small meals, like you can divide your meals and have. Suppose you're carrying two chapatis. If you're eating four chapatis, I would say two hourly. 2 hourly have two chapatis, or
Okay.
have a cup of sprouts. De- Decrease your refined products. Now what basically I see when a lot of patients are traveling, they have biscuits in between, so that
Hmm.
starts giving you a contribution of that extra refined thing. So use a chapati. So what four you had to have in breakfast, maybe you carry it in a box and then have two. Have a sprouts maybe after 2 hours later, if you're long distance travel. Have a half fruit like mosambi, orange, or apple. So that's how that peak would not be going higher. But do not miss your insulin if you are traveling.
Got it. Will this is a common myth, and a lot of people have common myths about this. Will insulin make a person gain weight?
Yeah. So see, definitely it's going to make you gain weight because insulin is the one which acts like
Hmm.
it actually acts at the level of the cells. It will make you gain weight. So there are newer insulins which are available in the market where the weight gain is not as much as the conventional ones which we used to use maybe 10 years back, 5 years back. We are having newer generations one where the weight gain is minimal, maybe 2 kg or 1.5 kg or so on and so forth in comparison to the conventional ones. So definitely, yes, insulin does cause some weight gain, but the newer ones are much better, much good improvement, and also lesser weight gain than the conventional ones.
Okay. Doctor, this is a common question from women. Will their menstrual cycle have an effect? And especially, for women who are going through menopause, will that be affected during because of the glucose levels?
No, there is no direct relationship of menopause and glucose being involved. But what happens in is the menopause condition usually causes estrogen withdrawal. So there is a estrogen which is going away.
Hmm.
So that increases your cardiac risk because estrogen is supposed to be protective to the heart. So hence that's why we say a postmenopausal lady coming to a cardiologist, to an endocrinologist, whomever. First, we need to screen them for heart conditions and also keep them aware because the estrogen also has a good effect on your bone. So they are more prone to develop a bone which is hollow from inside. That's what is called as osteoporosis. So
Oh,
postmenopausal osteoporosis is very important to be taken care of, which is I think that's the most untouched topic or untouched condition where our Indians focus at bone health. So like mental health, like sexual health, bone health is also very important and has to be paid equivalent and good importance to.
okay. Any good ways to avoid that
Yeah.
getting into
So
that
what
situation?
happens is that's what we say is keep a good calcium supplementation, keep a good diet of calcium supplements, maintain a healthy diet, walk, exercise. This is what we say, and we actually start then supplementing patients who are with postmenopausal with calcium. So I supplement my patients with calcium, and we do a BMD. So BMD is nothing but a bone mineral density test
Hmm.
where we look at their porosity or where we look at their bone strength. So if the bone strength is very low, we start giving them bisphosphonate injections, which are once in a year. So that will keep the tensile strength of the bone not to fracture or not to easily break open.
Yeah, good one. A lot of us, people who have diabetes, have these meters, glucose meters. So how often should you replace it? Because some of these are automatic, but we have a tendency to use it until it stops
Yeah.
working. But should
So
it be replaced?
what I suggest is the standard ones usually do not have a expiry date. It's the expiry date of your strips. So please watch out for your expiry date of the strips. Watch out for a battery sign which usually keeps popping up. I see a lot of my patients get a glucometer, the battery sign is popping up. So the battery sign, when it is saying low, it would start, see, any digital meter or any digital console thing you use. If the battery is low, it starts going to give you false positive values. Like it will start showing you higher maybe or lower values also.
Got it.
So it's our suggestion to keep a check on your battery status and also keep a check on your strips. If you buy it, usually the strips come for about say 6 months to 10 months expiry date. Keep a very close watch, because what happens is I've seen my patients, their son or someone gets it from US abroad and then they store it. One fine day they pick it up, check it, and then the sugar is showing so high because the expiry happens. So what happens is every strip is lined with a few chemicals on the strip. So these chemicals, when oxidized with your blood, give the result. So if the chemical is already washed out or already expired, it wouldn't give you the correct result.
Yeah.
So again, for people who want to go mountaineering, there are few other glucometers in the market than that's used for high altitude mountaineers, basically.
Because the
So there's
oxidation doesn't happen normally.
oxidation doesn't happen at the high altitude. So there are certain things which have to be used. So that's what is to be kept in mind, that glucose GDH based meters are for those kind of people, and hexokinase meters are for the people whom we use daily and day out. So this is what is again a common problem where I encountered a few mountaineers who use this at the high altitude and are getting different results. So obviously GDH meters, like Centura is the company which manufactures it. Uh, Other meters which are is the only company which manufactures it, and I think that's for high altitude mountaineers or someone.
But I love the idea, having diabetes, but they're not stopping there. They're still going for mountaineering. That
Yeah.
sounds so inspiring. That this is just one of the I would say symptoms, or not a major disease, but if you're taking proper consulting and proper medication, the life doesn't end there.
So there are a lot of personalities, film personalities, cricket personalities who have never stopped. We have a lot of societies for diabetes now. Now type 1 diabetes, if you look at, you have famous personalities who have societies and they're doing amazingly well. So
So
I have a child who's maybe 4 years old, is an amazing painter. Has a She's more trained than what I am trained to. So she puts a sensor here that's called as the ambulatory glucose monitor, and she's so trained at the age of 6, checks the sensor value, informs it to her mom, or puts a message to us. So they are more trained. She takes the insulin by herself. So that's how inspiring type 1 diabetes is. When we have people, I have patients who are at age of 50 scared to take insulin, then I tell them, we have patients who are at 4 years also, 6 years also taking their own shot.
good, yeah, good point. So life doesn't end after you get diabetes.
Yeah, so diabetes is a part of life. So you have to take it as a part of life. Do not take that your life ends here, or. And one more thing, what I would want to advocate or want to advise my patients, please follow genuine YouTube channels or genuine, content which is coming on media. So now we do not have content monitoring in India. So please don't be carried away by someone coming and saying on your some show and saying that stop your medications, you will be all right, or we will give you some food, you will be all right. it's
Yeah.
it's
So,
rather going to cause you harm. Please see, we have studied medicine for a long number of years. I would advise you, whomever you consult, but please do consult a practitioner for your good control, and do not start adventuring. So these are stunts.
yeah.
These are
Risky stunts
these are
which you'll be
stunts.
taking.
Do not follow risky stunts at home.
Yeah. So friends who are watching it, ensure that you go through YouTube channels which are from the doctors. There are a lot of alternate medicines that are getting being pushed. Some there's no scientific evidence to it. But yeah, always consult your doctor that I want to try this. If he says yes and wants to monitor you closely, maybe then take it. Otherwise, don't even try that, because some of these things can be lethal. So again, don't try some of these things. Whatever comes online is not true. And as Dr. Amit rightly said, even it's a case with my mom. She keeps forwarding stuff whichever is received as received. There's no vetting of whether the content is valid or coming from the right source. So
Yeah.
please be very careful about what you're receiving and what you're forwarding.
Yes. So Google Baba is one more unauthenticated source of information. So Google never reads medicine. So I request all my viewers, please content validate. If you're authenticate, read a journal. If you're a medicine specialist, you want to understand, read a journal. Ask us for scientific data, we'll provide it to you. Do not get carried away. You're absolutely, safe to mail us, talk to us wherever possible, but please don't do it.
Okay. Dr. Amit, what are the best or worst foods for type 2 diabetes?
So type 2 diabetes, now I wouldn't say worst, I would say to be avoided is
Hmm.
all the refined. So refineds are not good for diabetes, like your refined maida, your refined what do you call this, atta or something, refined flour which comes in,
Hmm.
that one. And then you have your rava, which is refined. Again, refined rava is not good, refined sugar is not good, white rice is not good. So these, any food which is high glycemic index. So I would suggest you again to follow that National Institute of Nutrition where it says high, low, and medium GI foods. So please avoid high GI foods. Take low GI foods in good quantities. Moderate GI or mid GI food should be taken in moderation. So moderation for mid GI, high GI to avoid. Low GI, again, you can take it in good number of quantities. So everything boils down to a glycemic index or a glycemic load of a food. So please do use a NIN website, that's National Institute of Nutrition. It has a good handbook for diabetics where you can know which foods have low GI, high GI, and medium GI. Kindly use low GI in good quantities, medium GI in moderation, and high GI please do avoid.
Okay. So, Dr. Amit, are there any side effects for these medications or insulin?
So see, side effects, some of them do present with a few side effects, known side effects, like your metformin or your, metformin tablet
Hmm.
usually comes with some amount of bloating or gastritis, or, it can cause like that. Now, newer ones like the SGLT2 inhibitors, there are certain drugs which can cause some urinary tract infections because they are genitourinary tract infections because they throw out the sugar from the urine. Or insulin would not actually have a side effect, but the side effect is when you take it a little on the overdose. So
Yeah.
once the dose of the insulin goes a little higher, or you have missed your meal but you have taken in insulin, it will cause the sugars to crash down. That is called as hypoglycemia. So the dictum of medicine is hypoglycemia is much more dangerous than hyperglycemia. So please try to avoid it. How would a patient know he or she has got a hypoglycemia? Is when the sugars fall below less than 70,
Mhm.
or patients start noticing sweating, tremulousness, starts feeling, as if the heart's keeping on cooling inside, shaky kind of a feeling, dizzy kind of a feeling. These are certain symptoms of hypoglycemia and should check immediately. So if you are having a hypoglycemia, you should have a glucon D or whatever glucose powder, anhydrous glucose at your home. Take a 15-gram anhydrous glucose in water, mix it up, take it, recheck your sugars, or call your attenders to recheck your sugars. And after 15 minutes, if still your sugars are low, you should again take it and recheck it. This is the home management. And for the attenders or caretakers who are looking at our video today,
Mhm.
have to know that if someone is just unconscious, check your sugars. If the sugars are less than 70, you can either give them a glucagon injection, which you can give as 1 mg dose stat, or if you have your glucon D or whatever powder, anhydrous glucose powder, rub it inside the cheek.
Okay.
Most of them do it is they try opening the mouth and putting the water in. So once an unconscious patient is there, you do not have your reflexes, which is normally which would cause cough or something. So it might go into your lungs and cause a aspiration pneumonia.
Okay, got it. Very valid point. I mean, this is almost like CPR, right? So,
Yeah, this is
people should be
something like
aware, not
CPR,
only
but yes,
diabetes, but people,
yes.
other than,
Yes.
diabetic people should also be aware of what.
Rather than getting anxious, you should be aware that how to manage this condition. So if you are having hypoglycemia or someone who is found unconscious on the bed, immediately check the sugars. Start rubbing a few glucose around the cheek inside. Put your fingers, rub the glucose powder till you get any emergency aid to transport the patient to the hospital.
Okay. Dr. Amit, final question. What do you suggest for a healthy lifestyle for a person to, so that they can avoid whether they have diabetes or don't have diabetes? What is that they should follow?
So the main mantra for being healthy is keep going. So if you do not go, you cannot be healthy. So I would suggest you to please keep going, exercise wherever possible, exercise in good quantities, have a healthy lifestyle. So what happened where we were children, we only had some few joints of junk food. But as our age started growing up, we have seen the joints are going two times higher, and the changes in practice have also become very different, where the patients or where the people have started to go into the joints more. We have a lot of transportation of food to home now. In maybe I was a child, I did not have that.
Mhm.
Now I used to go to school, but now school is coming onto the laptop. So everything is very, very different now. So we are in a situation where you are bound at home, you are homebound, but please make your homebound home also like a gym, or keep going. So wherever you are, do not just sit down at your home. Keep going around your house, exercise. So what will happen is you have to take the mantra is output more than input. So whatever you are having exponentially two times more than your input, you would definitely not gain weight or you would not have any problems with your diabetes.
Super. Dr. Amit, we have a question. Should I use artificial sweetener or real sugar in cooking, baking, etc.?
So artificial sweeteners are a good welcome sign. So you have natural sugars also, which are again not as bad as your marketed sugars, such as stevia. Now stevia is an extracted sugar from trees or leaves of stevudin is the molecule which comes in that. Stevia leaves are available. You can use stevia. It's much more safer than the other forms of sugars which are available in the market.
Okay. Thanks a lot, Dr. Amit, for joining us and sharing the insights. So, friends who are watching this, again, this is a platform where we're creating a lot of awareness. Where we want you to avoid diabetes if you get a chance. If you have diabetes, don't worry. We are trying to create a hope where you follow some of the tips and tricks which Dr. Amit Goel has mentioned, so that you're safe. And feel free to consult him. We will also share the handles where Dr. Amit, you can, if you're in Hyderabad, do visit him. Dr. Amit Goel's clinic is in Vikrampuri colony, which is in Secunderabad. Or you can also do a teleconsulting with him. So we will share their contact details in the description, so that you can personally get in touch with him if you have any questions, anything that is there in your mind. You're confused that people are giving you some suggestions, but you're not able to decide whether it is true or not. So some of these things you can clarify directly by consulting him. So we will share all those details. So again, thanks a lot, Dr. Amit, for joining us on the show. Anything you want to say?
Yeah, at the end of the session, I would like to really thank WurkTV for doing a fantastic broadcast of these diabetes programs and diabetes awareness. I'm very indebted to Ravi for being a beautiful anchor every time on the show, and then also Pulse Pharma for allowing us to take this thing forward. I would say they are also doing an amazing educational initiative. So it was nice to be on this show, and maybe we can do a few other shows
Thank you.
more.
थैंक यू डॉक्टर अमित फॉर कमिंग फॉरवर्ड एंड क्लैरिफाइंग सम ऑफ दीज थिंग्स, बिकॉज बहुत लोग डरते हैं डॉक्टर से कुछ पूछने के लिए. बट यू आर कमिंग क्लोजर टू पीपल, यू आर कमिंग क्लोजर टू ऑल द फ्रेंड्स इन दिस पर्टिकुलर प्लेटफॉर्म टू क्रिएट द अवेयरनेस. सो वी आर वेरी ऑनर्ड टू हैव यू हियर. Thank you, Dr. Amit. Thank you, friends, for watching this.